Okay, so in this episode, what we're going to be discussing and covering is disc injuries. More specifically, we're going to get a little bit more specific on what a disc protrusion is versus a disc extrusion. Extrusion, excuse me. So what we'll do is we'll talk about some of the subtle differences, what we call the nomenclature or the naming, and what it really means for you, and some research-based types of approaches that we would talk about, and what you should suspect in terms of your symptoms if you're having one of these. So what we're going to do is we're going to zoom in onto the spine here. And what we'll do is normally in your MRI or some sort of injury, you may see the disc or an MRI that says, hey, you have a focal disc protrusion or a lateral disc or some sort of extrusion. So protrusion versus extrusion. And that's what we're going to talk about. We will discuss a very little bit of the anatomy as well because we have talked about this in the past, but we will go through it a little bit again. So let's zoom in here, and I'm just going to delete things out of here so it makes it a lot easier for you to see this disc. So most of the time you'll see injuries at the L5-S1 area, but in this case we're just going to zoom in and talk about this one. Let's remove that. Perfect. So in the disc, what we do is we have this anatomy right here where the inside is the nucleus pulposus and the outside is the annulus fibrosus, right? So essentially you have this little nuclear material, almost like this jelly, hardened jelly-like substance in the center. And then on the outside, you can see like these little slits, right? And this ring. So the outside acts like an onion, right? So let's draw this over here for a second. So you have like this middle part, and then you have like these rings on the outside that really hold things in place, almost like a bullseye. So imagine this is colored in a little bit, okay? So now we have this outside ring, or these outside linear rings, and they have these little crosshairs like this, just like that right here, in different directions to help their strength. As you get injured, typically what happens is that the disc gets injured from the inside outward. So it gets injured from here going, and it starts to migrate going outward. The inner 1/3 does not have any types of nerves. So you can actually have injuries going on the inside here for quite a while because there's no nerves here, right? And it could start making its way going this way and this way and this way, and then start slowly filling it there. But maybe once it gets to, like, let's just say this point, this is the outer 1/3, that's where you start to have neural innervation or the nerves. So the nerves can get really sensitive and irritated to this type of condition, right? So as this nuclear material or this jelly-like material on the inside migrates or moves backwards towards the outside, you can get some pain. And you may have no pain for a long period of time. However, again, it doesn't necessarily mean that no injury is happening on the inside. So what's the difference between a protrusion versus an extrusion? And what are the symptoms that you may have? So typically, and we're going to talk about typical cases, but it's not always this way. So in a protrusion, we'll have this nuclear material migrate out here a little bit, like that, almost like this, and it's kind of like a budding. So think about something protruding out or stepping on that jelly donut, and it migrates to the back here, right? When it starts to migrate, it can get pressure, you can get deep, dull, achy pain, maybe some temporary, occasional pain going down to the leg, the thigh, the hip. You could feel the low back always achy or some sort of issue like that. And it could be relieved very easily sometimes, not all the time, but sometimes with certain positions and postures, and usually does better with movement over time. The main difference is that this protrusion only goes to here and it doesn't break the linear, these types of rings right within, if that makes any sense. So imagine if we draw this out and we have these rings just like this, and it rings around, and this protrusion occurs. It doesn't break through those rings, okay? Meaning if you have an onion and you cut it in half and you fill the middle of it with water, and you just leave it like that, essentially those rings are going to hold that water in place and it's not going to seep out, right? This nuclear material or this middle material here is not going to leak out from that protrusion. right? It's when it's extruded, or when you start cutting those rings here. So imagine if we take this little ring here and we cut it in half. And now we have this material that has the ability to start moving its way through there, right? Oftentimes it'll happen this way. That's an extrusion. That's where the material is literally starting to either leak out. So now what I want you to do is visualize a jelly donut or a donut, and you're stepping on it so much so that it actually starts to leak into the back, and you start seeing the jelly drip down the donut. Here's some interesting things about a protrusion versus an extrusion. So typically what you will see is symptoms. Let's talk about protrusion. So a protrusion, I'm going to say pro, you might get deep, dull, achy discomfort. It may have some radiation pain down to the leg. It may be alleviated with some movement, and it usually gets better with some movement over time, often the times, and especially if you avoid some of the limiting activities that hurt you. So you may take a step backwards. The difference in an extrusion, EXT, we're going to put an extrusion, is that you've broken these linear fibers here, and so you might have an increase in inflammation and pain. So think about that jelly donut where it's now leaking down the back. What's going to happen, right? If you leave it on the floor, ants are going to come up and eat and gobble up those that jelly, and that's like the inflammatory cells. So it's going to be a little bit more uncomfortable. You're going to have higher levels of pain, higher levels of inflammation, and you may find only one or two types of positions actually help you, and most of the time you're in a lot more pain early on. So that is the typical symptom differences between a protrusion and extrusion. So now that we understand the symptoms, let's us talk about what are some of the things that we can expect. So believe it or not, you would expect an extrusion because it's more inflammatory and more painful to heal slower, right? That is actually not always the truth, because what happens is with an extrusion, EXT, remember we have that fluid that's spilling over and into that area, right? So if there's that cut there and we have that fluid spilling into, we're increasing the inflammation, as we said, right? So think about those ants, right? Those ants are going to come in and they're going to gobble up all that jelly and that goo that's sticking out of here, right? And if those ants are gobbling up that jelly or that goo, what is that in the body? That's the inflammatory cells that are eating it away. So what can happen is that because it sets off such a major inflammatory cascade or system, that you end up being in a lot more pain. However, guess what happens? It erodes that faster, meaning it heals it faster, oftentimes. So you might be in more pain in a shorter period of time and feel more disabled, and I don't want to use that word, but more disability, more frustration, more anger, more limiting activities, and more pain. However, typically what happens is that you actually recover a little bit faster. It just also takes more time sometimes in terms of because they're both kind of irritating to some extent. It could take more time, I will say that, but it also could take a lot less time because you have that inflammatory cascade on your side. I forgot to also mention, in an extrusion, because there's more inflammation, you might have more symptoms down into the leg because it might hit that nerve and irritate that area a little bit more. So the nerves that come out down into this area and peak around this side here, you might have that irritation to that nerve root right around there. So you might have more irritation through that. Whereas a protrusion, in terms of symptoms, might be that deep, dull, achy pain. It might be a level 3, 4, 5, 6, or 7 at times, depending on the thing. Whereas an extrusion might be like a 6, 7, 8, 9 at a time, 9 out of 10 more often at times. And more people are actually going to want to see a doctor, take more medications from what my clinical experience with an extrusion than with a protrusion. However, a protrusion can lead to an extrusion, right? Because a protrusion is this bulging of that, and it hasn't yet broken. It's almost like a dam that's holding the water back, but the water's rising very quickly. And if you start doing more things, you're going to start adding a little bit more pressure to that dam, and it could crack and it could fail, right? And that's the same thing. So it's less severe in terms of an injury oftentimes, but it can lead to something more severe. However, most people don't typically take care of that until it's too late. So in terms of recovery for a protrusion, let's put a protrusion recover, right? What you may see with that type of person is them kind of actually avoid some activity for a little bit, but they really, these types of people are different because they actually may take longer to recover because the symptoms are actually in terms of less pain and discomfort, and it hasn't initiated that inflammatory or intense inflammatory cascade or system yet. And so therefore it actually might take longer to actually recover from a protrusion because one, there's no inflammation, and two, it may not be enough pain for people to actually ride home about and say, hey, I actually have an issue. Whereas an extrusion, it takes off the inflammatory components and it ends up creating a whole body inflammatory protocol or cascade. And when I say cascade, I just mean initiation of like it just setting off the inflammation, and it can cause more pain, and more people are more likely to actually seek treatment with that. The problem is that with the extrusion, people typically do not find a lot of comfort very often. However, they can heal faster than people with a protrusion, if that makes any sense to you guys. So these are the major differences between both of them. One last time, I'll just recap. Symptom-wise, a protrusion may feel a deeper, duller, achy pain in the back, whereas an extrusion, you may have more inflamed pain and more pain going down to the leg at times due to that inflammation. However, an extrusion often does very well because it sets off inflammation, whereas a protrusion is not yet inflaming the spine enough where it sets off that inflammation cascade to a high enough level. So it actually may take longer to heal from a protrusion than an extrusion. So those are the main differences between the protrusion and the extrusion. And hopefully this helped you out a little bit and gave you some insight to what the differences are. So if you have any questions, guys, for any reason at all, please feel free to drop a comment, reach out, contact me in any shape, way, or form. I'd be happy to help. But this is the main differences, and this is something that we and you need to know in order to know what to expect on how to heal from a disc injury. So thanks again, guys. Have a great day.